Hello and welcome to the CDO Magazine interview series. I am Pat Haller with CPC. Today I have the pleasure of speaking with Brian Shea, Chief Information Officer at MedOne Healthcare Partners and Interim Chief Information Officer at the Lexington Clinic. So Brian, pleasure to be with you this morning. Excited to talk to you.
Thank you. Thanks for having me.
Obviously, technology, innovation, a lot of things are very important to your business and to making sure you're staying competitive and delivering what customers need. How do you retain the talent that internally to deliver on those things?
Yeah. So from a technology side, it's one thing. From then the rest of the organizational side and provider side is a whole nother beast. And I know we'll kind of focus on the tech side here. For this conversation is, we've been fortunate, and I think a lot of that's how you leverage technology as an organization, and it comes into play on your staffing needs, right? On what you need. It changes the skill set, right? Of course, that you need in an organization. Since we're relatively, leaner type IT, and we leverage technology, I focus more on having internal specialized IT. I call it specialized IT, but it's people that are focused more on the business driver type things, very specific type skill sets, that provide more value, to us. I think at the end of the day, there's operational type IT that you just have to be good at, bricks and mortar type stuff, patching and maintenance and security and help desk and those kind of things, right? The things that happen. I think that you have to have good mechanisms in place for those. So how we've kind of done it is we leverage internal IT staff. I leverage external IT staff. We've actually had, knock on wood, I would say this knock on wood, one of these kind of comments is we've had zero turnover. In my time here working with MedOne. If anything, we've added, people to the IT team.
Okay.
I think that our style and our culture of our organization helps, in our environment for maintaining people as a whole. From an IT perspective, as I said, I go back to those three parallel pillars: people, process, and tech. So from a people perspective, we're big on staff development. So it's having the opportunity of having the open relationship where you could just have conversations, right? That you want that flow of conversations to happen, but you also want to have those more specific conversations as well, and some sort of reoccurrence of how am I continuing to develop as an individual, right? It might be everything from time management to effective communications to I want to get these certifications or I want to do these different things, right? So constantly having that kind of conversation helps that we're not just focused on you coming in here and churning and doing your job and doing your work, that there's a balance of we want everybody here to continue to improve, within the organization and as an individual, right? So, you can take those skill sets and do anything with, but the more we empower them, the better we're going to be as an organization. So we do focus a lot on the people aspect. And we have several ways of doing that. We have in IT specifically, we have monthly one-on-ones, where we go over, kind of the even core values. We touch on core values of the organization. We touch on, again, the staff development side. We touch on projects. Then I have a weekly kind of touch base as well, like just a team midweek touch base, making sure everybody's on the same page. So everybody, if there's a hot topic going on that week, people could get it out there, right? And we also leverage collaboration tools effectively amongst our team. So I think we communicate a lot, right? So we're a big Microsoft shop. We use Microsoft Teams. We have an IT department channel. We're constantly communicating, on that. So I never feel like no one knows what is happening within IT. The goal is to have that across the whole organization. Right. So, I think, there's areas where we're good at that, and there's areas that we have opportunities, for that as any organization that has, lots of different departments and they're spread out all over the place physically. And, how do you maintain that? But I think making sure that you have good collaboration and good open communications, with your staff. We're surveying our staff right now, as an organization, right? Getting their input, the good or bad, right? Or areas of improvement. Because that's important to us, right? To again maintain the competitive edge is we need to maintain our staff, and as a whole organization we have actually pretty good low turnover as well. So not just IT.
Yeah.
I think that's kind of healthcare a little bit as well. I kind of seen healthcare kind of has a tenure, in a lot of organizations, good or bad, right? So I think
Right.
you have to figure out then how do you keep those, again, staff relevant? How do you develop and train? How do you give paths? How do you make them feel valued? I mean, all those things are
Right.
all real, right? And they're all important. Otherwise, people are going to leave for different reasons, right? They're going to leave
Yeah.
for, better benefits, potentially, different compensation, whatever is important to them at that moment in their life, right? You have to always kind of be moving around and figure out, how do I keep all those things kind of in check the best I can, right?
Yeah.
As a group. And I think we do a pretty good job, of that.
Well, have you guys, with the employee surveys, have you received any feedback? Are there things, I mean, it sounds like you guys do a really good job of focusing on the whole person and really not just, hey, this isn't, just your day-to-day here to do, what do you want to do, helping them develop and grow? But have you gotten positive feedback, or
Yeah,
what are some of the challenges maybe?
Yeah, so that's all going on right now for the
Okay.
days that we're going on. So within the coming weeks, I could tell you, like how we're doing, how I think we're doing, and how everyone thinks we're doing, right? But I think again, we don't wait for just those. So you get to hear, as I said, since we have that culture of kind of open communications for the most part, it's kind of that 80-20 rule. I think, we're 80% of us, I think we feel like we have good open communications that are occurring, and that hopefully that is. So you get to hear, firsthand, where I'm physically in an office here and I'm kind of waving off here, I have a director of IT that sits over here. Well, they get up and they come over, and we talk throughout the day. So you do kind of get the gist of what's going on all the time. And I think a lot of that is just because of the open communications, that we have.
Awesome. When you mentioned, you alluded to it a little bit, you use a lot of collaboration tools. Have you guys, is it more, are you back in the office quite a bit? Are people still remote? Like, how is that impacted how you manage folks?
Yeah, so we have a little bit of a hybrid for our back office staff. For the most part, being a healthcare organization, we're a lot of hands-on, like the providers are a lot of hands-on, right? So there was always, even through COVID, a lot of expectation of, we're supporting those providers, we're present, as well. I think, getting into, we do telemedicine as well. So we have providers that could do telemedicine from home or take call from on home. On the IT side or the back office side of the organization, that I'm in, we have several people that are kind of a hybrid, right? They're a couple days in the office, they're a couple days remote. I'm kind of more of an advocate of that flexible workforce type environment, because I think you have to be more, I've worked in organizations that are national, right? So I'm kind of used to that dynamic a little bit of staff being all over the place, but being, I think, results oriented or performance oriented, if you focus on those things, it doesn't really matter, where people are at. I think there's a purpose and a place of being in person and having in-depth conversations, depending what the topic is, right? Are definitely, I think, sometimes more impactful if people are together. I do believe that. But there's a lot of things that happen that are just you're consulted on, or you need to be informed on, or things like that, that I think the virtual and remote force is perfectly suitable, for us. I think we're going to probably be in a hybrid type model, like most organizations. I think they got to find that sweet spot, for them on, on what works and, what doesn't work. But I think it's any organization is hard pressed to take a hard stance and say, we're 100% in person, right? Or we're 100% remote. Because now that people also have a taste of it a little bit, and they see that, hey, I am more efficient, or I can do more, do more things in this environment. It's going to be hard to bring them back, especially if there's organizations that are allowing that and they want that. So I think you have to be flexible as an organization and to be able to kind of find that, again, that balance of, what makes sense from a culture or, within for your organization and your business needs may be different, right? So it's finding that balance, but I definitely think a flexible work environment, hybrid type environment is the future.
Okay. What in that, and I see a lot of the clients and customers we speak to in the similar boat, but is that presented any specific technology or IT challenges? I know you mentioned security a number of times. That's always a potential
Yeah,
concern when people aren't there.
yeah.
Is there anything specific that you guys have dealt with or had to deal with now with more of the flexible workforce?
Yeah, so I think it's one of those things from a security perspective, people have always had some level of remote workforce,
Mhm.
right? What happened with COVID is that it accelerated it and exploded the amount of time for people to
Mhm.
work remote. So there were a lot of people that were faced really fast with technical challenges and
Mhm.
hurdles to be able to do that. I think as I mentioned, we're 100% in the cloud. So
Yep.
our architecture from a technology perspective is perfect, right?
Mhm.
To enable remote workforce. Being in a healthcare organization, security, of course, is forefront, from
Mhm.
a HIPAA perspective, a compliance perspective, um, you know, making sure our patient information, making sure us accessing our customers, patient information, or, just employee information, even, right.
Mhm.
All that is done in a secure way. So we are very conscious on our architecture of leveraging, um, a lot of cloud, taking into consideration the cloud-based type environment that we have,
Yep.
but there's still, and we also put it into policies and things like that of, if you're a remote user, here's your home checklist, and those
Mhm.
kind of things too. So you got to attack it again on all fronts, right? Some of it's policy, some of it's tech, some of it's
Mhm.
education again. But I think that it's important that you do layer in the security aspect of, you need to know where your data is. You need to know how your data is being accessed. You need to know all those things, right? And you need to protect it the best way that you can, right?
Mhm.
With tech. And I think we've kind of laid out that architecture where we've gone from a technology perspective to be able to do that. And I think cloud has enabled us,
Mhm.
if more than anything, right? And I do get into that debate with the on-prem security, and that's where a lot of people struggled more so,
Mhm.
right? Because they had on-premise tech and maybe cloud tech, right? That they had
Right.
to from a home user that may or may not be their system, right? And I think that's where we saw a shift as well, is a lot of organizations they didn't even have the equipment to give people to work remote.
Right.
So they quickly switched to a BYOD type policy, which opened up a whole nother thing of,
Yeah.
well, I don't know what I don't know, on their system.
Yeah.
So it really changed the focus to identity and access management.
Mhm.
And what can people, who are you, what can you get access to, right? I
Right.
mean, at the end of the day, right? So it
Yeah.
really focused a lot of people focusing on that multi-factor authentication, starting, you hear zero trust thrown around,
Yeah.
what does that mean? And, but I think it really forced people to focus on that identity and access management side for
Mhm.
sure. And then layering in some new kind of maybe monitoring type technologies or data loss prevention type tools, because the
Mhm.
way the data is flowing now a little bit. But I think cloud technology has helped accelerate that and enable
Yep.
organizations to do it in a more effective, efficient way, really.
Okay, awesome. Well, final question. I mean, it sounds like you guys, obviously with very high retention levels, you guys do a lot of development, the internal staff. Is there one thing you wish you could do better, or is there something you're focusing on in terms of, keeping and retaining that staff?
Yeah, I think everybody wishes they could do more things, right?
Yeah.
It's not enough time in the day, right? Kind of stuff. I think the biggest thing I think that we can do better is, again, work-life balance,
Hmm.
making sure that people, we have such good people, in the organization that want to do the right thing, right? And you have to find that balance in, especially, I think, remote, this is the bad side, right? Of remote
Hmm.
workforce enablement is, it enables people to be able to access anything anywhere.
Yeah.
And how do you get the people to feel like, hey, that's not an expectation, right?
Right.
Of you as a leader or an organization, that's great. There's a difference between someone's loyalty and wanting to jump in and wanting to do things, but from a health perspective, we have to find a good balance of making sure that
Hmm.
people know where that line is. So, and it's a two-way street, right? So us as organizations and as leaders need to make sure that we're aware of that and we're being conscious of it, and we're not setting the wrong expectations, right? Versus you as an individual might you got to learn to let go, too, right?
Right.
There's some things on your shoulders that you got to balance it personally, as well. So I think being conscious of that, because tech is not slowing down, the push for new projects or new innovation or constantly changing and it's go, 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 right? So I think it's making sure what we could do better is making sure that we're setting true organizational priorities, knowing that priorities could change, but setting a good message and communication down to everybody so they know at least we're all going in the right direction, together. It's okay that there's change, but when there is change, we're all on the same page about that change, right? And then you can reprioritize effectively. So I think, effective communications, prioritization, everybody can improve on those. And I think, that's a focus of ours, to continue to do that, because you can't do everything, right? So you gotta figure out what's the most impactful things to us, as an organization to focus on.
Well, thank you, Brian, for joining me today. It truly was a pleasure. And please don't forget to visit cdomagazine.com for additional interviews. Again, been a pleasure. Really enjoyed our conversation today.
Thank you, Patrick. I've enjoyed it as well.